I'm guessing at least another month.
Yeah.
Or we're in the process of trying to get back up.
Okay, then no, because I don't want to
Dead.
demonstrate.
What is that box?
I will let you know.
Back when they had the crash of the dump truck, that box.
Really?
What are you here next?
Chassis. I guess we. I was like, are you kidding me?
Yeah.
I looked at it, right?
Oh, yeah.
She's Oliver, Wednesday night, I work night shift. You can just come bring that in.
It's dead. We can't
She
get parts
was
of
ready, but it might be nice, because I had other stuff, and then I picked up extra.
So they're trying to get us something to.
Good. Yes.
Thanks, guys.
Thanks.
Nathan is over at the FBO, so we gotta walk over there anyway. Anybody just use like the restroom
Let's do
real
it.
quick? Exactly.
Do it.
Like, we're all probably closed by now.
Yep. Bathroom break for sure.
Do you need ice? Ice?
We thought we were gonna have to get out, and push that spreader up the hill the other night.
I will need to do it.
Yeah, I know. Seriously, is it got a headache?
You can turn it on.
What?
Smack your hand. Bathroom, you go? We're gonna go to the bathroom.
I'm trying to get.
Back, we're going to the bathroom.
I wouldn't bid it on that.
Huh?
I wouldn't bid it on
Jerry, you can go to
wastewater.
the bathroom alone, you don't have to have a buddy.
I'll go with you.
Jerry?
We can leave the med bag.
You got it.
Yeesh. Yeesh indeed. This is starting to pull the thing, the stretcher out.
Just right.
Okay.
I'll turn the monitor on and then.
Just wait on me. Okay.
How does it not start?
Here.
Here.
Hey, how are you guys?
Hi, gentlemen. How's it going?
Pretty good, pretty good. We got dispatched for a 32-year-old helmetless motorcyclist that hit a deer apparently. They're
Okay.
across the road in a ditch.
Okay.
He's pretty cold. At 70 over 44 when we got here. Mike's got 2 IVs going. Got up to like 85.
Got a weak radial pulse.
He's
How's he ventilating?
Still living pretty well.
been pretty cold. His wife talked to him last night about 8 o'clock, and
gloves
that's
on.
it.
Okay. Go ahead and give a breath.
Motorcycle cold.
I've got equal chest rise, chest fall. Cut his clothes off. Okay, I've got a laceration in the left hip. I have active bleeding coming from this side.
Quite a bit.
Seems like a lot.
Yeah.
Okay. That's kind of in a bad spot. We're gonna need to do is it arterial?
No.
Okay. Pelvis stable.
Toby?
Feels stable.
Yeah, it sounds pretty good.
Okay. Okay, we're gonna need a T-pod too. And then open
It's got a lot of blood.
left shin. A lot of blood. Arterial.
Sure.
Okay.
I mean, it's
All over the place.
splattering out.
Okay, I'm gonna put a tourniquet on.
I got a heart rate of 130, blood pressure is 85 over 40, and 91% right now.
91%. Okay. Patient have a gag reflex.
No, he's got cocaine in there.
Okay, do we want to put a supraglottic in?
Sure.
Let's do that so we can move to the aircraft if you tolerate it.
I don't know how to do that.
I'm going to tighten this down until the bleeding stops. Tourniquet on. Gonna write the time. Check that. Alright. Alright, partner. I'm just gonna have you bag in. We've got 2 lines. You wanna set the stretcher up, partner?
Sure.
So we can transfer the patient. We would size this for the patient.
Like he is what he needs.
We have airway leaving.
I mean, yeah, where it lives.
press sounds? Okay. Alright, we got good press sounds, IV access, got a tourniquet on, unstable pelvis. Let's do set it up so that we got a T-pod on the stretcher when we put him on our stretcher.
Okay. Do you want me to go back to the aircraft to get it?
Do we have a sheet? Or do you just want to recognize that
No.
it is messed up?
I think we'll have to do it in the aircraft at this point.
Okay, let's do it. So we're going to use some blood products, which is laying on the ground, so let's replace that. And then as long as this airway is working, we'll roll it back. Yeah, those things are kind of a bugger.
Okay.
And then drop that back up. And then I can carry the monitor and the cords and ventilate. And then as long as we got a jerk here, person down there at the feet that is diving onto the track.
Alright, we'll go with this one.
Good card.
What side?
The back seat. Got that?
Yep.
Okay. Monitor coming up.
I'll set it right here.
Door closed or no?
No.
You want to pull this back towards me? I've got bagging.
Okay.
Alright, let me check pupils real quick. Unequal right side, probably about a 4. Left side's probably about a 7 or 8.
Alright.
Got bleeding left forehead. Is it open? Depression?
No.
Nothing?
Just
Okay.
looks like that.
Let's let's do a unit of plasma.
Yep.
Please and thank you. And then while you're doing that and we're lifting.
Yeah.
Okay.
Why don't you set this up? What else did you want?
Plasma. Let's do TXA.
Okay.
Different line then.
Let me get TXA going. You set up the warmer.
Thank you. Heart rate still tacky. Okay, and then we'll prime that, and then
Okay,
this
let's
goes
TXA.
in like so, and then strap. Yeah. Oh goodness. Okay, we're hooked up.
Okay.
I got a green light. I'm gonna move this. You're alright with that?
Yep. Alright, plasma's going.
Plasma's going. Okay, so let's replenish, which is what we're doing now, with the unequal pupils. We could consider 3%. You got TXA on board.
Yes.
I don't want to give pain meds quite yet because I don't want to draw them.
You gotta put the plasma on.
That is important, isn't it?
Yes. Disregard this. Okay.
Okay.
Now it's going.
We running?
Yeah.
Okay. What do you think, partner? You want to try the 3%? It'll give us a little
Sure.
extra fluid, and then little more of a fluid bolster, and then it'll also help with those unequal pupils.
Okay.
We're gonna give half the bag, 250 for 15 minutes. Okay. And then, how's his airway? Doing all right up here? No complications?
It's exactly how you have it. Feel it.
Okay. Let's get, I'm gonna see if I can reach this end tidal out of the left side of the aircraft. Do we have an open one?
You do in your airway bag.
Okay. Thank you. You pull that Velcro. Just while I pull. Alright. I got my end tidal hooked up. Map 60 would like at least 65. Taking another pressure.
Alright, 3% is going.
3%'s going. Okay, still getting 80 over 50 is our.
We got a couple minutes on our plasma.
Couple minutes on our
And then,
plasma.
or a minute basically. This will be done.
And we could do the PRBC. We can also do, we've got a line on this other side. We could do a fluid challenge just to help a little bit since he did lose so much. Since we've got this other line on our left side,
Sure.
we give 250 LR,
Alright.
warmed LR.
Do it out of a liter bag. What are you gonna make that tubing?
Yep. There is nothing in this bottom pouch.
Alright. You want it on the pump? I can take it then.
What's that?
You're wanting it on the pump.
Well, there's nothing at all except this flashlight in this bottom.
Alright. I'll put it on here.
Nothing. Okay, so we've got will you reassess that left leg tourniquet and make sure that's still tight and there's still no uncontrolled bleeding? Are you able to sneak a hand down there?
Yeah, it looks good.
Looks good?
Yep.
Okay. And then that left hip,
Your plasma's done.
let's do a unit of PRBCs. It just always looks like something needs to be filled out. That's I don't like that.
Yeah, I've looked my entire day.
85/54. Getting better.
I apologize, I interrupted you. What do we want me to do down here?
In terms of what? The
The tourniquet looks good, and then you were talking.
there was that open lac on the left top of the left hip. Is that bleeding still controlled? There's not a whole bunch of
Yeah, the bleeding's still controlled.
it's not kind of line because we could reach down there to that top trauma pocket and grab acrylics and just throw some acrylics on top of that.
Okay, I can do that. It's still pretty crunchy.
The hip is.
The pelvis, yeah.
Do we want to try to sneak that teapot underneath him?
You tell me.
Let's do it.
Whatever you want.
We got time. Let's do it. I'm still ventilating for him. He's still bagging well.
What? Where's your gauze?
Take him under pressure.
Alright.
How can I help you, Margaret?
I don't know, this is a
It's not beautiful, is it?
one job. Detach this string there for me.
Just until I saw it rotate. Secure. Kind of helps with that pressure on the acrylics.
Yes.
All right. Pure VCs, TXA, bagging, fluid challenge, 3%. 90/57. Map goal 65.
Okay.
I like it. I like it. How far out are how far out are we from COX now?
Looks like 7 minutes.
7 minutes. He does look about mid-30s, doesn't he? Yeah. Have switch over to the here channel. COX Air Care 1, COX Air Care 1.
COX South we are, go ahead.
COX South, we were inbound your facility about 7 minutes out with a mid-30-year-old male, was on a motorcycle, deer versus motorcycle, traveling approximately highway speeds. Patient was GCS3, unresponsive at scene, being ventilated via BVM. Patient is now being ventilated with an advanced airway. Patient has received 1 unit plasma, 1 unit PRVCs, 3% saline, fluid challenge at 250 mLs, TXA. We are about 7 minutes out. Vitals are as follows. Heart rate is sinus tach 125, blood pressure is 90/57, end-tidal CO2 at this time is 32, SpO2 on supplemental oxygen is 95%, or via advanced airway is 95%, GCS still 3. If you require anything further, we'll be with you in just a second.
Alright, we'll be waiting on your arrival.
And then I'd also radio back and ask them to maybe send us a little help up to the pad.
Alright. Still got 5 minutes of flight. Anything else we want to do? This bag of cells looks like it's done.
Let's do the next one. Still tacky. Blood pressure's definitely doing better. We could consider still unresponsive to any stimuli, painful stimuli.
Oh, he's got a little eye flutter once in a while.
A little eye flutter. Still tolerating the LMA though.
Mm-hmm.
Okay. I'd probably with this next unit we could consider a little bit of fentanyl. Not much, but we could definitely give him a little bit of fentanyl. The bagging, he's tolerating the bagging really well. I mean, we could have definitely put him on the vent, and I think we should always consider to put him on the vent when we are coming in, but he's just doing so well on the bagging and we're about to pull in, so. Do you want to try it?
The vent? I think it's a good idea.
Yeah, let's do it.
What else? We gave TXA, we've given the blood products.
Pelvic binder, bleeding control, tourniquets, gave him some warm fluids, he got warm blood. He's oxygenating. Doesn't seem like he needs a chest tube or a needle decompression.
No, I don't think so either.
Make sure he's bundled up and trying to conserve as much heat as possible.
Sure.
Being that this is the we're on the second unit of blood products, right? This is the
This is
second.
our third. So we go
This
to
is the
plasma,
third.
and this is our second red blood cell.
So
three for
we could
us.
definitely give some gluconate, calcium gluconate with
Okay.
two units of blood products. Give calcium gluconate, and then 4 would be chloride.
Gotcha. How much calcium gluconate do you want?
10 milligrams.
10 mLs.
Yeah. That's what I meant. Okay, PSIV, good. Oxygen, 100%. You roll with that and titrate that down. 10 a peep. Let's see, what am I at right now?
Alright, calcium is going in.
Calcium's going in. Do you want to hand me that, the vent tubing? Pretty please, pardon.
Yeah.
Alright. Whenever you're ready, I will try it.
Alrighty.
Alright. Vents on. And then, just based on his height, male, and then we can see how he oxygenates with the LMA.
It is working this way.
Oh, okay. And then we can titrate down on the FiO2, just
Sure.
as he's tolerating.
Alright.
Yeah, we're getting pretty good chest wall.
Yeah.
And what else? Anything I'm forgetting, partner? Let's see.
There
Airway
is, your
breathing
scenario is
circle.
now complete. Just off time.
Just off time.
Yeah.
Okay.
It, first, anything you would do differently? Take back, change, anything?
Probably just verbalizing the vent sooner. You know, it's
Get
just,
your hands free.
yeah, and I thought about it. I was like, and then I was like, the LMA. I don't know, because I'm bagging right now, and what if I put it on there and blow it out? But then of course I know what I can do.
Right.
You know.
Well, and your bagging is probably the same pressures as the vent. You just aren't following them,
Yeah.
right? There's just no feedback system.
Sure.
And we use LMAs in surgery every day.
Yeah.
So
Sure.
it should tolerate
Sure.
it. obviously, yes, if you put it in there and then like you're like, what the Sam Hades, or all those settings were true, then yeah, okay, maybe this isn't working.
Yeah,
I'll
consider
give you
something
that.
else.
Yeah, but I think it's worth it to at least try. Maybe throw an ET2 tamer or something on there to hold that LMA in place, and
Yeah.
then put it on.
Oh, that's a good point. Yeah, throwing that tube
But we
in
have
there.
like this many things going on. Like, we need 2 people's hands if we can.
Absolutely. I think the only thing that, like, the big thing I'd probably change is, like, of course we moved him on the backboard on our stretcher, but, you know, with that mechanism, just maybe not jumping to conclusions, but grabbing that T-pod and bringing that with us so that when we do roll them to do a back sweep and then put them on our stretcher, we can just put that down, because, I mean, that's a pain in the ass to do that, so.
Yep.
But other than that, I felt like that went pretty good.
Yeah, I do too.
This seems like, I liked it.
Yeah, agreed. Anytime it's a motorcycle accident, at least for me, just due to how you sit on a motorcycle and that there's 100% some sort of metal, like between the legs, like the pelvis is usually the
It's
first
gonna
thing.
split, yeah.
So most motorcycle accidents, I'll just throw it in the airway bag and take it with me. If I don't need it, I don't need it. But that doesn't mean you have to do it that way in any stretch of the imagination. It's just something. Anyway.
Sure. I like it.
ANSF.
Hands have open
big
fractures.
old ass, yeah.
2 grams for under 120 kilos, over 120 kilos, 3 grams.
Yep, perfect. Yep.
Dang, I didn't even. Yeah.
So some of those, like, that's how you can start getting volume in also. Put your 2 grams in a 100 ml
Well,
bag,
yeah, I mean,
and then
if
now
I'm
that's your flow challenge, right? You know, like,
If I'm doing the LR, I mean, I might as well have freaking ANSF rolling too,
Yep.
so.
yeah. That way you're kind of using, because I don't want to just give fluids for nothing. He needs blood, and I don't need to thin it out anymore. I'm not going to act like I have never given 100 mLs of ANSF to try to just get some sort of pressure while ripping this stuff in. How can I make the blood go faster?
Pressure bag.
Pressure bag. Yep. Pretty simple. We have them. Use them.
It's on the inventory list. Where the two pressure bags.
Yep. Because they're handy. They're so simple, but they're so handy.
In the bag, and then fluid warmer.
Yes. All right, sweet. We will reset and do the last one.
Do you feel like do you think anything else?
No.
I think it went actually pretty smoothly.
Yeah, I do too.
Maybe I did learn something.
I am a fan of going to the LMA, getting out of there, and then, like, as we're getting progressively better, like now I can put a tube in, and it's going to be no big deal. Like, even, like, on actual flights and stuff.
Yeah.
I've been adopting it more and more.
And that's like a little bit of a ground thing for me. Sometimes I'm like, oh, if it's working, I'm just not going to change it. But, like, honestly, like, he's going to buy himself a tube. And, like, the first thing they're going to do is freaking yank that shit out and put an ET tube in.
Yep.
So.
But it's not like
non-glue bag, a cable bag, pouch in the main compartment. Do you usually just bring the whole thing with you? Just grab what you need.
Those big, that, you mean?
Do you just bring this whole thing in with you? Okay.
I do,
I was just curious.
because some facilities have a square and some have an oval, and so then I don't have to even think about it. And then half the time I just put it, in there, wherever you want to put it out there.
I'm just gonna put it right up here on top of the pads.
Somewhere I can't lose it, but.
Oh yeah, that is hideous.
She sounds hideous.
Well, she's a he, so.
What are you wearing?
Oh, cat. Alright, so the wheels are stretcher out, thank God.
Mm-hmm.
Actually, I can do that, sorry.
It's over here. It's still plugged in.
She sounds hideous.
I don't know.
It's fine now.
Is that an
It was
indicator of
pulling
low
out a little
battery?
bit. From the green thing.
Drop
back
our
in
last.
there.
Was it unplugged?
No, it was
Slightly?
a little slightly unplugged, yeah.
Drop
That'll
that.
do it.
You're losing your job is basically where we're at.
I was just feeling a couple times when she's about to leave south and Joe and made coffee and she went down and got CDs thing in her.
Ready?
Yeah, well, good thing so through and not facing it back to John.
Yeah, the minute,
Yeah.
dude, they give me a hard time as well. And I'm like, no, I promise you we
That
can.
and a
We've
little
been doing
bit
it
of
for a month.
caffeine just to be sure.
Or am I consuming something?
They're under your cot, right?
Oh, under here.
Yeah.
Sweet. Perfect. All right. Ready?
Ready.
Yep. All right, we're ready to.
And action.
And commence.
Hello.
Hello.
How are you?
Good, how are you?
Pretty good. So this is Andy Johnson, 63 years old. He came in today complaining of severe abdominal pain and also coffee ground emesis. Sent him to CT. It showed severe diverticulitis. He's probably going to need emergent surgery, which is why you're taking him to COX South. He had become altered, so the doc decided to intubate. So currently he has a 7.5 tube. It's at 24 at the teeth.
Okay.
A little bit hard to bag though, I'll be honest. He had back about 45 minutes ago.
Okay.
We have an OG or an NG tube place who had 900 out of coffee ground emesis.
Did you get an x-ray for this tube?
Yeah, we did. Actually.
Do you actually have a syringe laying around right now?
I do. I'm pretty handy.
If you've got a syringe for me.
I do. Here you go.
Oh, thank you so
Yep.
much.
Respiratory left to go get a functioning vent. That's why I'm bagging.
Gotcha.
It's been a minute.
Alright. Okay. I'm going to, Carly, I'm
Let me
going
tell you vitals real quick. Heart rate's 130.
130.
TP 70 over 40, 90% on 100%, and 95.5 says 10.
95.5.
5.
Okay. Has he had any antibiotics?
No. He's got an order for Vanc. I haven't given it yet.
Okay.
We do have 3 other drips going.
Okay.
He has octreotide going at 30 mics an hour.
Okay.
He has prop going at 22 mils an hour. And he has dopamine going at 5 mics per kg per minute.
Okay. And what'd you say that pressure was?
70 over 40.
70 over 40.
Yeah.
Okay. I'm going to back the tube out because it's not 24 anymore.
Okay.
And then, would you mix up ketamine, 250 and 250?
Okay.
And we'll titrate the propofol off and put the ketamine on. You good with that?
Yep.
Sweet. All right. I just want you to keep bagging. Oh, and would you hand me this entitle CO2?
I gotcha.
You didn't happen to have a 250 bag, did you?
I don't know. Let me
If
look.
not, I can peruse one.
All right. We are at 24 at the teeth and plate.
Okay. That's much easier to bag, yes.
A lot easier.
Yeah, I can tell the difference for sure.
Okay. That's reinflated. Thank you for that syringe. I'm gonna
Yeah.
listen to breath sounds real quick while you're
Okay.
bagging.
These are end title.
Oh, perfect. Thank you. I'm gonna pop this off real quick.
Okay.
That looks perfect.
And pop that back on. Do you have labs and
Yeah,
like
right
patient paperwork packet
Yep.
for Sal?
Yeah.
Oh gosh, I'm just gonna have to walk around.
If you just put this in that side pocket there, it will pick up your readings for you. There you go. Give you a little more slack. There's
CO2.
EKG for you, and here are orders and labs.
Thank you.
Yep.
What'd you say his name was?
Andy Johnson, yeah.
You give a breath. Perfect. Doing alright for you?
Yep.
Need any help from me?
I think so.
On aspirin, propofol 22, bank not started. You've got that bank over here.
I do.
Okay, sweet. We'll just take that with us.
Yeah.
Thank you.
There you go. Did you say you wanted this probe off?
Not yet.
Oh, okay.
Not yet, sorry. I'm gonna wait back. We'll get a breath again.
You're not gonna fix that sound if that's what you're worried
Oh,
about.
yeah. Yeah. That's what I was worried
It's been an
about.
all day thing, so,
It's just what he sounds like.
yeah.
Okay. What rate did you want on the ketamine?
1 to 2 mg/kg.
Okay.
Yeah.
Alright. 2 it is.
60 inches, 73 kilos. He's allergic to amoxicillin, GI bleed. His mental status.
Your octreotide has moved over.
Sweet.
You have the octreotide?
Yeah.
And then, let's see, the dopamine.
Yeah, it's 1
Let's,
5.
yeah. Take that off and put Levo on.
Oh, here you go. See, I told you I was handy.
Oh, look at that. Beautiful. Do you want this on that clip over there?
You also have an hour line on the side, by the way. Just letting you know. You said 2,000 mils of NSN.
How much?
2,000.
Of NS?
Yeah. Kelly, do you need this bag or no? Okay.
I'm good, thank you.
Okay.
So he's at 2,000, that is.
Did you say dopamine off?
Not quite yet.
Oh,
Not
okay.
until I get to Levo. I'm sorry.
No,
Thank
you're
you.
fine. I'm just trying to.
2,000, so they're just over 2,200 pretty much is what the 30 ml per kilo would be for this patient.
How much does it weigh?
73 kilos. So 30 times 73. I got 2190.
Alright.
Do you want to set up our stretcher? spikes per minute.
Levo's starting at 10.
This is the propofol. Got the. Where do you have the?
What?
Where do you have the ketamine going in it?
That side.
Somewhere in there.
Right here. Okay.
This will be prop and
What are we at on the pro?
22 mils an hour is what it's supposed to be at.
Okay. Have that ketamine running for a second. So we would ideally like to just get the ketamine on, let it work, and then down titrate on the propofol, and then move that off.
Okay.
Since we've had that on, then I'll take the propofol off since we've had the ketamine on, and get levo running.
Oh. Is that what you are doing?
Yes.
Propofol is coming off. And the levo is started, correct? Or no?
I'm flushing this line, and levo started.
Okay.
Now you just have dopamine still.
And then, now that the levo's running, we can give that just a second, down titrate on the dopamine, which it's not on much anyways, and then we'll turn that off. Yeah, and then now that we're switched over.
So turn this off. The dopamine off.
Yeah. Yes, please.
Okay.
Thank you, ma'am. SIMV, and he is 60 inches.
Ready?
And we are ready. Yeah.
Here's your art line.
Oh boy.
She was handing you your art line stuff.
You can just verbalize what you want that pumped up to.
So be pumped up to 300. If it's already been on, I'm just gonna ensure that I see the green.
Okay.
It's been 10 minutes on the scene. We should go. We would tape this to the chest
Okay.
at the ecostatic axis.
Alrighty.
That is
Your end.
Would you hand me some tape?
Yep.
Thank you.
You bet.
Will you retake that pressure, Carly?
Yeah.
Oh, it won't tape to the skin. Just tape on it down. How about that?
Roughly in the place I want it.
Alright.
Okay.
You hit that art line button.
I'm gonna open it up to atmosphere, zero it.
Okay. So you're open. Now what do I do?
You're gonna hit 0. So off to patient.
Okay. Zeroing.
Okay, putting the cap back on. Closed off. Sweet.
104 or 64.
I like it. Let's go.
You do have a Foley on the other side. Just don't forget that part. Everything else up here, you're disconnected.
Does not look great.
No, it isn't. Well, you know what we'll do for that? Take me where's my bank? It's sitting here somewhere. Okay, cool. We got the bank, we got the paperwork. That's our paperwork package.
Ketamine, levo, octreotide. Got it.
Ketamine for sedation, levo for the pressures. Pressures are already looking better off of the propofol. Got the art line. It's matching. Heart rate's still up there. And we fix that in the helicopter. And then we'll get the bank on board in the helicopter.
Alright. Perfect.
Good with that one?
Good with that.
let us,
do.
let us know.
Right.
You wanna fly, ma'am?
Alright, we got all our equipment, ventilators, everything's flowing, vents still running, everything's hooked up, ringing, that's shitty.
I know, yeah, the foot was like, alright, come on in.
Alright? Yep. I'm gonna keep coming, just tell me if I need to stop.
Cheese food?
Airway bag. It's all beautiful. Oh, don't close the door.
Nah.
Alright. Where's my bank? Come here, bank. Ideally, my pressure bag would be up somewhere. It's gonna sit right here in this corner.
No, it's not.
No, it's not. It's most definitely not.
How much? Can you get it to your gear meter back here, or is it just strapped?
It's just strapped. It's like stuck in his lap belt.
That's fine. Got it.
Got it?
Yep.
Alright, check that. Make sure tube's still at the right place, still ventilating well. It's beautiful. 0, 0. Just great tidal volumes.
It appears to be a tidal volume about 350. Minute volume is 70.
Okay. Sweet. Now that we're launching and we get up to our altitude, we need to re-zero his R line.
Okay. Do that.
So we're gonna do our, oh god, not quite yet. Turn off the patient, open the cap, and then we can do this again. We're gonna hit our 0 button.
There.
Atmosphere, 0, cap back on, and back off to atmosphere. Sweet, still got good pressures.
Okay.
Still tacky. In tidal 40, SpO2 is great. Let's take a temperature. Able to reach that. See if I
You're
can.
acting like my arms are a foot and a half long.
Oh.
98.6.
98.6. Wow.
Where it's headed down cold sepsis.
I like mine version better, personally. So, do you have some tubing over there that I can put this tank on? 'Cause I'm still empty over here.
I sure don't. Where are we gonna put it?
Huh?
What are we gonna put it on? I got 3 drips going.
Oh, you do have 3.
You got octreotide, sweet, octreotide, ketamine, ketamine.
Oh, nurse. Oh, wisdom
Uh-huh,
nurse. What is octreotide?
It is specifically for GI bleeds. Short
Okay.
version.
Does it work very quickly? What's the mechanism on GI bleeds?
I don't remember.
Okay.
Have to look it up. Is there any other way we can do that in this aircraft?
Is there any other way?
It won't look normal.
It won't look normal. I mean, we've got the syringe pump is literally all I can think about.
Alright.
Just pull up as much as we can in the biggest syringe we've got and roll with that.
Yeah.
Yeah.
Or switch one of these to that. Whatever.
Yeah, I mean, the ketamine.
The octreotide's only going at 6 mLs an hour.
Oh my god.
So we could suck it up into that.
Yeah. Yeah. We could just switch that to the syringe pump.
Yeah.
And then put this on that pump because this is going to run, what, 132 mLs an hour? 138?
It's basically an hour.
Yeah. An hour for the full gram to be in.
Yeah, yeah, yeah.
Which in our flights from Barton County to south is, what, 25 minutes, 30 minutes?
Yeah. We'll still do it. Alright. Alright. I will do all of that.
You'll do all of that. What do you need from me, partner? Oh,
I guess what else you want to do?
Okay, so the tube was too deep. We got the paperwork. We've got the antibiotics. We switched him off of the propofol and dopamine because his pressures were garbage. So he's on levo and ketamine for sedation. We could consider pain.
Okay.
I would imagine that with how buried that tube was, we could go ahead and give him some fentanyl.
Okay.
Just if there was any trauma, if he's still, yeah. Why not work on both? Okay. It's just a lot of scrambling. Sure, that looks like fentanyl. And I'm just gonna steal a syringe.
Fattest bottle in the whole thing.
I'm just gonna see it. Oh, sweet. Do you actually want to pull it up?
Oh, you can use air.
Okay. I'm gonna pull up the full 100 of fentanyl. And then I've got some extra to play with. And where are you, sir?
He's getting some fentanyl.
Oh. I'm gonna give 50 and see how he does with that. See how the pressures do. Art line 104/64. I'm taking a non-invasive blood pressure. See how that heart rate does with some fentanyl. End title's still good. We haven't changed altitude yet. I mean, honestly, his pressures are doing good. We can consider vaso with the sepsis.
I gotcha.
He also, but he has got that GI bleed, so if he did deteriorate, we'll just go with a blood product for some fluid bolster. Monitor the vent, make sure that all looks good. Stuff's running. We got our stuff running still.
Yep.
And
Vent's going.
Vent's going. How far out are we?
1 minute and 30 seconds.
Oh, Jesus. Realize that I have done goofed. Call south. South is Air Care 1.
South PR, go ahead.
Hey, this is Air Care 1. We're coming in from Barton County with transfer. 63-year-old male, chief complaint, altered mental status, fever, GI bleed. Patient is intubated at this time. Patient is on drips of ketamine, levo, and vancomycin. Barton County did report coffee ground emesis. Tube is currently, patient's oxygen is 96, intubated. Vitals are as follows. sinus tach at 130, blood pressure 104/64, end tidal 40, GCS 3. Don't have a sugar at this time. We'll see in 30 seconds.
What? Okay. Sounds good to me.
And then I would also consider he's got the hook our NG tube up to suction.
Yep.
So,
I think that'd be appropriate.
and then get some help because we've got a lot of stuff to juggle.
Yeah. All right. Scenario's complete.
We're done.
Ta-da!
Ta-da!
All right. Anything you want to take back?
Probably the NG-OG tube, considering that when we first got in the helicopter.
Sure.
I didn't think about that until just now. Probably asking my lovely nurse, what's it called? Oxytocin? The GI bleed.
Oh, octreotide?
Octreotide, yeah.
I got you. Yeah.
And realizing that maybe not the most important thing in the world.
Maybe not, but also treating the one problem he has, for sure.
Yeah.
Like, I think it's fair to be like, well, let's just, if we have time, right?
Yeah.
And that's the slowest one. I think it is appropriate to let's suck this one up.
Yeah.
But he's also
put it on the syringe
septic, so your antibiotics within that first hour are really the gold standard. So yeah, everything's fine.
Okay.
I think it's appropriate to get the banks started, and it's appropriate to utilize your syringe pump also.
Yeah. I think the only other thing would probably be just the I don't know where you pulled this out of, but just making sure, like in real life, there's like it's gonna be easier if you like down titrate on the stuff that they've been on and get our stuff on and working, and then kind of like don't just go and jerk them around.
Which is true. You get into a kind of a weird, like, how long are you gonna wait on scene for that threshold? I think actually what you did was correct. I completely agree. We need to be getting our stuff on and running before we're ever turning their stuff off.
Yeah.
That's for sure on the vasopressors, right? You're gonna screw yourself. It's pretty hard on that.
Especially like whatever effect that they have done with that stuff, which is not the right choice.
Right.
Don't want to take that and throw that away.
The nice thing with the dopamine was that it was at 5, which is pretty low dose.
Yeah,
so our
it's not
levo
gonna
at 10
cause
is
any-
gonna suppress it pretty quick.
Sure.
But no, I thought your thinking on that was perfectly.
And if we had to titrate up on the levo, start considering something else. The vaso.
Sure. Yeah.
Yeah. Hit about 15 and start being like,
yeah.
Maybe a little something else. So.
All right.
Sweet.
Let's tear it down and we'll be done. That's it.
Cat?
I think so.
Sweet. Speak freely.